Hello everyone, my name is Rohan Janwadkar and I'm a third year medical student at FAU College of Medicine. I'm excited to be presenting about pediatric applications of focused ultrasound, also known as FUS. Consider how a magnifying glass focuses beams of sunlight onto a single point to burn a hole in a leaf. This is similar to how FUS uses an external acoustic lens to concentrate multiple intersecting beams of ultrasound energy on a precise target in the body. This non-invasive therapy results in many important biological effects. FUS is especially advantageous in the pediatric population as it targets tissues deep in the body without exposing the child to surgery or the risks of radiation. In 2019, there were 17 pediatric clinical applications of FUS, but as you can see, the pediatric clinical indications have been historically lagging behind adult indications. This presentation will highlight the major mechanisms of action and applications of FUS in pediatric diseases across a variety of organ systems. Thermal ablation is FUS's most widely explored mechanism of action. It occurs, as you can see in this diagram, as high-intensity acoustic energy elevates the temperature greater than 60 degrees Celsius in a precise location. This causes coagulative necrosis, disrupted membranes and proteins, and cell death with minimal damage to the surrounding tissue. MRI image guidance allows for real-time thermometry and anatomic targeting with superior resolution, while ultrasound guidance allows for real-time anatomic targeting. The mechanical effects of pulsed, low-intensity focused ultrasound can either reversibly decrease the functionality of targeted neurons or trigger the activation of neural signals. The thermal effects of LIFU can also temporarily suppress neural signals without destroying tissue. A novel mechanism of action for FUS is targeted drug delivery. One option for targeted drug delivery is thermosensitive liposomes as shown in this diagram. These liposomes have a thermosensitive lipid bilayer component, which is shown in blue in the diagram, that can allow for enhanced permeability and retention, where the FUS beam locates. This promotes the content drug release, which are the orange dots in the diagram, at a focal location. So with these mechanisms in mind, I'll now go through the various applications of FUS to specific pediatric diseases. This presentation will not be exhaustive, but will cover the highlights of FUS pediatric applications. So beginning with MSK applications. Osteoid osteoma accounts for 11% of benign bone tumors that usually causes severe nocturnal pain. Current standard of care includes surgery or radiofrequency ablation. However, MR HIFU therapy has received international approval in Europe, Russia, and China as a non-invasive alternative treatment option. The image on the left highlights a transducer with a simulated beam path in sub-image C. The image on the right shows a complete restitution of an MR HIFU treated osteoid osteoma after 3 years with complete resolution of symptoms. Next, desmoid tumors are locally aggressive tumors that can occur anywhere in the body, causing significant impairment. Desmoid tumors can infiltrate surrounding tissues and thus be very difficult to resect, leading to a 50% recurrence rate after surgery. Ultrasound HIFU and MR HIFU have been used to treat extra-abdominal desmoid tumors in pediatric patients. In this image, you can see an enhancing lesion of a desmoid tumor of the thigh in a 7-year-old boy on the left. On the right, you see a non-enhancing lesion post-FUS treatment, indicating that there is no more vascularity and successful ablation. Over time, this will resorb. Next, we have the oncological applications. Pediatric soft tissue tumors account for nearly 14% of all pediatric malignancies. Children with metastatic or recurrent sarcoma have a poor prognosis with a 5-year overall survival rate of 20 to 25%. Preclinical studies have shown the success of HIFU as a treatment option using thermal ablation and targeted drug delivery in the treatment of pediatric soft tissue tumors. The image on the right is an example of the mappings used during FUS treatment to delineate targetable lesions. Currently, there are 2 clinical trials for FUS therapy of pediatric solid tumors. Next, we have the neurological applications. Hypothalamic hamartomas are rare benign tumors that emerge during fetal development. There are 2 major clinical phenotypes of HH, precocious puberty and epilepsy. Surgery is often first line but is difficult due to the surrounding hypothalamic tissues and high risk of surgical complications. HIFU therapy uses MRI guidance with the goal of thermally ablating the connection between the hamartoma and hypothalamus to disconnect it from the surrounding brain circuitry. If possible, it is also used to ablate the hamartoma. The image on the right is from a patient who presented with hyperphagia symptoms. Immediately after FUS treatment, her hyperphagia symptoms disappeared. Sub-image B highlights the HH in red circles 3 months after FUS treatment. Although there's no drastic change in the size of the mass, the patient's symptoms completely resolved. Venous malformations are the most common subtype of congenital vascular malformations. These lesions are clinically evident later in life and can cause local and systemic complications. MR HIFU is an option for ablative therapy that offers lesion visualization, temperature monitoring, and an immediate post-treatment assessment of effectiveness. The image A on the right shows an enhancing mass causing severe pain. Image C shows the absence of the VM 5 months after treatment, with pain being resolved after treatment. Future applications for FUS in pediatric patients include DIPG. DIPG is an extremely aggressive brain tumor that is uniformly fatal and the leading cause of childhood brain tumor death. Current research is focused on blood-brain barrier opening and allowing for increase in focal therapeutic delivery. In this diagram, we can see that low-intensity focused ultrasound can temporarily open the blood-brain barrier by opening tight junctions, increasing transcytotic vesicles, and decreasing efflux proteins. This allows for various therapeutics to enter and stay in the brain parenchyma. Here again we have the outline of pediatric clinical applications of focused ultrasound as of 2020. There are 4 distinct mechanisms of action that are applied to pediatric diseases across a variety of organ systems in 7 clinical trials. Thank you for your time.